Good afternoon. I'm Dr. Priscilla Slanetz, a breast radiologist at Boston University Medical Center. I would like to speak to you today about screening mammography, the only proven test to reduce a woman's chance of dying from breast cancer by up to 40%. Given that routine mammographic screening has this benefit, then why do so many women skip screening or only undergo mammography intermittently? The answer is multifactorial. But I know that if we want to save the most lives, then we must get the message out that mammography saves the most lives if screening is done annually starting at the age of 40 years. The past few decades, there has been much confusion over when to start mammography and when to stop. But the reality is that 1 in 8 women will develop breast cancer in their lifetime, and the most years of life lost happen to women who are diagnosed in their 40s. So it's very important that all women undergo yearly mammography starting at the age of 40 years and sooner if someone is at increased risk, for example, having a mother or sister with premenopausal breast cancer. I also know that women are sometimes getting mixed messages from their doctors about screening mammography. So as radiologists, we need to continue to educate our colleagues as well as the next generation of doctors, our current medical students and residents, as the evidence really does support yearly mammography. Now, mammography is not going to be a perfect test. There will be some false positives. Some patients may need to come back and have some additional pictures, an ultrasound, or possibly even a biopsy that turns out to be benign. But in my experience, nearly all women are willing to have a false positive as they want to find their cancer as early as possible. We also know that the earlier we find a cancer, the more treatable and curable it will be. The smaller the cancer, the less extensive the surgery, and the lower the chance that you might actually have to have chemotherapy. So for those of you who have been putting off the mammogram, why not get it scheduled today? So what about other barriers to getting a screening mammogram? Well, although the screening mammogram is 100% covered by insurance as part of the Affordable Care Act, the additional pictures and any biopsy that might follow because there is a finding on that screening mammogram does often incur some out-of-pocket copay or deductible. So for some women, they just can't afford to pay for those additional tests. There are also unforeseen costs. Some women can't afford to take time off from work to get the mammogram, or they have difficulty with transportation. Thankfully, some hospitals provide free transportation and others offer mobile vans. But we need to know who these women are, as they're not necessarily going to ask for help. And that's why radiologists really should be asking women about the social determinants of health when they come in for any form of imaging. Because once we know the potential barriers, we can then help connect those women to needed services. And finally, we need to create a welcoming and inclusive environment. Being able to communicate to patients in their native language by offering a robust interpreter service is key to helping patients understand the importance of having a mammogram and taking the next steps if needed. Finally, there still is a need to educate patients from all cultures and backgrounds. There are still too many women out there that don't think they need to have a mammogram because they don't have a family history or any risk factor for breast cancer. But what women need to realize is that over 75 to 80% of women who are diagnosed with breast cancer every year do not have a family history or any other risk factor. And that's why it's so important to get this message out that all women should be screened starting at the age of 40 years. And if someone does have a family history, they should meet with their doctor or a genetic counselor to undergo a risk assessment, as they might need to start the mammogram earlier than 40 and possibly even undergo additional imaging, such as an MRI, a contrast-enhanced mammogram, or a whole breast ultrasound. So it's October. Let's get that message out and save the most lives. Whether you're at the mechanic with your car, or at a cocktail party, or on the soccer field, make sure all of the women you meet know how important it is to have a yearly mammogram. Wear some pink, and let's all embrace breast cancer awareness this month and every month for that matter. That is how we can all make a difference. Thank you.